Welcome back to the Arizona Daily Mix. Okay, a lot of people have been exploring surgery. It's plastic surgery. But with Miami and Florida opening up to more people are traveling there to do it. But with me is Dr. Hussein is telling us that you make sure that you have the board certified surgeon working on you because, doctor, we've noticed, I hate to say this, a lot of pop-ups have been happening with the pandemic and COVID and people getting out, and you really want to talk to the people about being safe by doing this, and again, it's going to the right people. So how are you doing today?
I'm doing excellent. Thank you for having me on your show, Brad.
So, and I like already, I like the name already, Dr. Miami Beach, right there, Dr. Miami Beach. So, where'd that name come from?
It started out actually, I was in scrubs about 6 years ago, walking out of my car in Miami Beach. And a group of people were, they started kind of pointing at me, giggling a little bit. They're like, "Are you Dr. Miami?" And I kind of, without missing a step, said, "No, I'm not Dr. Miami. I'm Dr. Miami Beach." And they loved it, and it stuck, and it grew from there 6 years ago.
Wow, amazing. But before that, let's go back, because this is very interesting. You are a veteran who has served our country. How'd you go from there to becoming a plastic surgeon?
Well, I actually had a kind of first career as an orthopedic surgeon, and I did a lot of trauma and sports medicine for about 9 years in the military. And then after I served my time, and after serving during, Operation Iraqi Freedom and Enduring Freedom and taking care of our soldiers in Germany, it was time to get out. I got out of the Army, and that's when I started my civilian practice and came to Miami to become a plastic surgeon. I did additional training in plastic surgery.
Yeah, wow, that is so cool. And you said something very important there, plastic surgery, because there's I think a difference that people are getting confused. There's cosmetic surgeons and then there's plastic surgeons. Let's talk about the difference there.
Sure. It's very confusing to the public, and I even talked to my physician colleagues who are not aware of the difference, and I'm glad you brought that up. And one thing I advocate is patient safety, and patients need to know who's operating on them. I think an important question to ask is not just, is your surgeon board certified? Because you can be board certified in specialties other than plastic surgery. I think it's very important to make sure that your surgeon is certified by the American Board of Plastic Surgery. And that requires a minimum of 6 years of surgical training. There is an additional board of cosmetic surgery, which does not require you to do any surgical training other than attending a partial, more or less, it's a partial training. I'll just leave it at that.
Yeah. And with that, you are wanting to make sure patients are staying safe by guiding them through the difference there. And what's some of the ways you're doing that?
So one of the ways is obviously talking on the show and is public awareness. Another way is I've decided to become somewhat of an active voice in my area. In Miami, there's a Miami Society of Plastic Surgeons, and I'm currently the president. So we try to make the public aware, especially in the city of Miami. Unfortunately, there's been some unfortunate incidents that have made the news, and almost all of those incidents that involve at least a death or an ICU and intensive care admission probably could have been prevented if the patient went to the appropriate trained surgeon and if the surgeon adhered to appropriate intraoperative safety measures.
Yeah, and that is so important. That's why you are getting that word out there to people. Look at the fine print. Look at who's actually doing the work on you to make sure that they are certified. And if you don't know, you have your organization that they can come to. But also, doctor, what I like is that you are educating and being mentored to the up-and-coming plastic surgeons, because they're probably looking at the quick way, and you're saying, no, it's getting back to what we came into this field about.
Yes, that's a very interesting point that you bring up. In today's world of social media and Instagram, it can be somewhat misleading seeing a bright and flashy website and a bunch of likes and comments which does not necessarily reflect the surgeon's training nor their outcomes. To build a successful aesthetic surgery practice, and I also make a difference between cosmetic and aesthetic surgery. Again, I think there's a differentiation between the board of cosmetic and aesthetic surgery. So to become a successful aesthetic surgery, there's no shortcuts. Yes, your website and your Instagram and your social media counts for a lot, but the number one factor is word of mouth, good outcomes, and patients referring, for previous patients of yours, referring patient friends of theirs too.
There it is. All right. Good outcome and word of mouth, because you have a specialty called etching. What is this?
So abdominal etching is a relatively new procedure. When we talk about breast augmentation, facelift, neck lifts, we've been doing those for decades. I started doing abdominal etching approximately 8 to 9 years ago, and I've kind of enhanced on my techniques. I've written a paper on it describing my surgical technique. And if you looked, 7 to 8 years ago, almost nobody was discussing abdominal etching, and it's become a passion of mine. And I've been doing it for a while, and I really like to, in males, show the six-pack abs, and in females, the six-pack abs are it's not necessarily the look most females go for. They tend to want a little softer, lines to be seen, such as the hip lines that go into a V this way, and the vertical lines that go, up and down. So abdominal definition, high def liposuction, that is definitely my thing.
Let's see. I could probably be on a flight in just a little while. You're saying you give me that six-pack abs? Is that what you're telling me?
I could, but you just have to have nothing to eat or drink on that airplane flight because you have to be on an empty stomach. Usually I say nothing to eat or drink after midnight.
Dr. Miami Beach, tell people where they can find out more about, of course, your work and also what you're making sure we're staying safe with plastic surgery.
Sure. Probably the best place to start is my Instagram, which is dr.miamibeach. There's also a website, dr or drmiamibeach.com. And then finally, the Miami Society of Plastic Surgery is miamisps.com. And that's a very select group of board-certified plastic surgeons who have to pass a screening process, including having the appropriate type of practice, basic things, seeing your patient before surgery, intraoperative safety, and seeing your patients after surgery. They sound very basic, but not all surgeons do that, believe it or not.
Wow. Dr. Hussein, thank you very much for all that. I'm glad, and like I said, I might be seeing you sometime soon. We'll see what happens. But thanks for joining me this morning.
We would love to have you here. So anytime you're ready for that vacation to Miami, we're here for you.
All right.